I believe that had it not been for our ability to partner with the private sector, we might not be sitting here today. I believe that if we were unable and unwilling to recognize that perhaps the greatest economic engine, the greatest engine of innovation our nation has seen in healthcare doesn't come from the government, it comes from the private sector. That if in fact we had not had Warp Speed partnering with the private sector, we would not be having a conversation in person in this nation and maybe in the world, and that the death toll would be multiple times higher than it is today. Am I in the realm of possible?
I firmly agree. I think what was really strong about Operation Warp Speed was the collaboration and the skills that were deployed by industry with the help and advice of government, but really the U.S. government relied on what are decades of experience with experienced and small and medium manufacturers to really deploy the best of science for a really important goal. And doing it I'm still marveling. I've been in the vaccine business 25 years. I'm still marveling that we made these extremely important, efficacious, and safe vaccines in a year and deployed them in 6 months. It's incredible what we've done.
I remember sometime in April, May of 2020, when I think it was NBC that said that the theory that we were going to have a vaccine within a year would take more than a miracle. It was nearly impossible to have any appreciation or expectation that somehow, some way, with all the great minds in the world working together, we could do what we have done. And so I do think we should have a longer conversation about the power of partnership and the synergy of public-private partnerships in many areas of government. I think we could easily miss the point of why we're having this hearing and why we're able to have this hearing. However, I have questions about virtual health and telehealth, and I'll get to those prepared questions, so thank you for that. When I think about the pandemic, I don't find many silver linings at all. The death toll is devastating. The number of folks who have recovered but not fully is just mind-boggling. What I do see, however, as the possibility of a silver lining is that perhaps the telehealth conversation accelerated forward 5 or 6 or 7 years. But in that silver lining, I think about in rural America, rural South Carolina, where 1 out of 4 people don't have the ability to connect because they have a flip phone, no phone, or not a smartphone. 15% of Americans find themselves in the same category as almost 1 out of 4 rural Americans. The telehealth platform is so important that we probably need to spend more time investigating audio only in that telehealth delivery system with integrity in the system to make sure that we're talking to the patient if we can't see the patient. I think this platform needs greater investigation and frankly more resources. Thoughts on that? I'll just start with you, Mr. Becker.
Thank you, Senator. Yes, absolutely. I think telehealth has advanced because of the pandemic, and there is infrastructural problems to getting it to the last mile and in rural areas. When we were at Public Health in Harris County, we put the mobile telehealth on mobile vans and drove them out to communities of need that didn't have access. And we found community centers with extra space to set up this private rooms so patients could come into the community centers they were already visiting and have access to those services while they were there. So there are solutions, Senator, but I think, again, going back to your previous, we need to work with our local partners, but also our private partners to figure out how to get that technology and those services out.
Thank you. Let me head to my last 30 seconds here. Dr. Jantz, my mother's worked in a hospital for the last 47 years, and I think about all of our emergency responders who are willing to stick around and do their jobs in the face of losing their own lives. And I know that the importance of PPE and obtaining the drugs that were necessary. Did your hospital encounter any problems or challenges with PPE or drugs?
Thank you, Senator, and thank you to your mother for her service over all those years. We obtained and maintained adequate supplies of PPE and medicines during the pandemic. It did require lots of work and effort, asking lots of other hospital systems around the state and country to help us out with those items, but we were able to maintain those items, and by just the generosity of our community. In spring of 2020, community members were dropping off N95 masks in the lobby of our hospital for us to use on the scale of hundreds to thousands of them a day. It took a village, but it worked.
I'll say, as my time has run out, Madam Chair, that the excellence that we've seen in America's healthcare system is a marvel of the world. And I think bills like my Made in America Act that would provide more reasons to bring your PPE home and your generic drugs being made here in America is a necessary component of what I consider resiliency. Our nation needs to be more resilient when it comes to challenges, and one of the ways for us to get there is for us to work in a bipartisan fashion together to bring home some of those very important resources to our nation. Thank you for the extra minute.